Welcome back, folks. You're with Free My Pain Now with Dr. Matt DiDuro, and today I have a special guest, attorney Michael Gumpert.
You got it.
Wow, it's a tough name for a dyslexic kid that, and I've known you for years.
Yes, you have.
I always call you by your nickname that you say on the radio.
Okay.
But, so listen, so excited to have you on. Today's feature is titled Avoid the Curse, which is, the curse is, hey, I'm in a terrible car accident here in Atlanta, Georgia, or wherever our listeners are, and metal and steel of your beautiful car get crumpled. You are just thankful to be alive after the wreck, and you're just glad, you walked away from it. But now your concern is, how do I get my car fixed? And what we've noticed here in the last 13 years being in Atlanta, I've noticed that more patients that come in, they're more concerned about their cars being made whole and not so much what happens to them after the accident. Your specialty, Michael, is in personal injury.
That's correct.
Which sometimes has a bad rap.
It does. And there's a number of reasons for that. I mean, most reasonable people, I would say, the second they hear personal injury attorney, they immediately think of cheesy billboards or weird commercials or the stigma of being an ambulance chaser. And there is some validity to that. But one of the underlining things that I think drives a desire for personal injury attorneys, at least ones who genuinely care, to get in contact with a family that may reach out on behalf of someone who's injured early and try to get them signed up as clients, is not greed or trying to, profit off of somebody's injury, but actually this underlining desire to make sure that the person is completely taken care of, and not just with regard to their vehicle, but like on an almost daily basis. I get calls from people who maybe right after a wreck happened, their first focus was the car, but maybe as some time has progressed, they're continuing to experience pain that they thought was just muscular pain or, just common aches that might go away that didn't. Mm-hmm. And there's some legal significance as to why getting an attorney early, as quickly after a wreck as possible, can actually help protect you and help make sure that you don't have any obstacles in getting medical treatment that not only serves a purpose of helping you heal, which is what you're in the business of doing, mm-hmm. but it's also legally significant as well, in that there's no break in something that we call the causation chain, mm-hmm. to where a gap in treatment might indicate to an insurance company or to a potential jury that, the person's complaining of aches and pains a month or so later, and it'd be very easy for them to say, oh, that's not from the car accident. How do we know they didn't go home and fall mm-hmm. down the stairs or something else happened? So
documentation is so important. And really, when metal and steel of a car get crumpled, that force is transferred through our bodies. So whiplash, per se. I mean, sometimes, unfortunately, emergency room's not the best place for them to go. Unless there's a bone sticking out or blood, the way they triage them, whiplash is very undertreated, especially concussions, which we're going to have a special coming up on concussions. But, Mike, I was lucky enough to meet you through one of our young ladies who ran our call center. Was in a terrible car accident. It was on New Year's Eve or New Year's Day. And she found you. And I was just so impressed what you did and how far you went to make sure that both Stacy and her daughter were taken care of. And I just didn't see that in lawyers. And I thought, this is the type of guy I want on my team. And, we love sending you people, and you take great care of them. So what do you say to that person after they're sitting on the side of the road, the car is smushed? Like, what's the process that they have to think about?
Well, that's a great question, and I certainly appreciate the kind comments. I see the entire process kind of in my head, meaning, for someone who's never been in a wreck before, they're kind of thinking, okay, I need to call the insurance company and sign their forms or give them this recorded statement that they do. You don't want to do any of that. Mm-hmm. There's a lot of leverage, I guess I would say, that you retain after you're in a wreck, specifically with regard to your body and any potential injuries that you might have, that you don't want to just freely give up simply because you feel like you're getting something done. When in reality, you might be just doing the insurance company a favor for helping them minimize how much they have to pay you. And again, not that it's about money or profiting off of a situation, but you have to be cognizant in your mind that you've got maybe your family that you have to take care of in addition to yourself, and you don't want to cut yourself short when you still don't know what the full extent of the mechanics of, a collision, metal on metal, as you say, can then transfer, those forces transfer in your body and could do anything from perhaps just muscle pain to you might have herniated discs in your neck or in your lower back that you don't know are sitting there. It could be causing you immediate pain, or they could be sitting there like time bombs waiting to cause you problems many years down the road, far sooner than you otherwise would have through the normal aging process. So there's so many factors and moving pieces.
The thing I always like to say is the true effects of that car accident may not show up for 2 days to 2 months after. So yes, call the police, make sure you get a report written up, go to the emergency room and get x-rays, get evaluated, document, find out where you're at. But I can't tell you how many people 2 months, 3 months later come in and as we're doing the case history, oh yeah, I was in a car accident on this day. And I'm like, oh, did you get treated? No, I didn't think so.
Yeah.
You hear it every day.
I hear it all every day. I get calls from people, like I said, it might be 2 months after the accident. They're still having pain. They want to know if there's something that they can then do about it. And it becomes very challenging legally, because if there's been no treatment during that, say 2 months or however long that it's been, it becomes difficult to be able to argue that the pain that they are currently experiencing was caused by the wreck because there's been no treatment during that gap period. So one of the benefits that we bring is the ability to make sure that people are not making medical treatment decisions based purely off of their own financial circumstances, to where they're not having to worry about, am I coming out of pocket for this or not? Mm-hmm. We can make those arrangements so that they do not have to worry about paying for their medical treatment up front with various providers or funding companies.
That brings me to my next point. So many people, they don't want to sue. They don't want a lawyer. But really, not only are you protecting their best interests and understanding the policy limits of that case, but you're going to make their car corrected, right? And they're going to make their whole body, what do they call that?
To be made whole.
To be made whole. That's how they.
Certainly in Georgia, you're entitled to medical bills, compensation for medical expenses, lost wages if you're employed, mm-hmm. pain and suffering, which has kind of become a catchphrase that people don't understand. It's not just physical pain and suffering, but it includes a number of, sub-elements that include all the effects that it has on your life. And we seek financial compensation from that from the insurance companies in what I deem is simply holding them accountable. A lot of people hesitate to hire a lawyer because, I don't want a lawsuit. I don't want to sue the person personally. It was just an accident. But these cases almost always involve not the person who caused the accident, but their insurance company. They collect the premium for that reason, and that's why we see the commercials day in and day out. Mm-hmm. You're familiar, like a good neighbor or someone's on your side or whatever, and those promises that are made to the public over and over again that they're going to step up and do their job to take care of you when you're hurt. And my job is to then hold them accountable to that promise. And my clients are never going after the person who caused the accident personally. It's always through their insurance carrier, and that's a very important thing to remember when it comes to the motivation for getting a lawyer involved.
And so many times people think, I can do this, and they're on the phone and they're making calls, but it's scary because they're being recorded. Yeah. Anything they say can be held against them.
Right.
And, I just think it protects them. And, we hear stories every day of really bad car accidents here in Atlanta. I mean, this is one of the worst areas in the country. So, I want to make sure that people avoid that issue of, man, I'm fine, I'm good, I don't need to go to the emergency room, but then they're left with ongoing issues.
It's important immediately after a wreck. Certainly, if you're having or experiencing any pain, do not hesitate in getting that treatment, even if it begins with emergency room treatment and they simply look at you and say, well, you're not bleeding to death and nothing's broken. Go home and take some pills. But if there's that lingering pain, providers like you and other providers that, attorneys can help make that arrangement, make that connection if necessary, so that they can get the treatment. And then, of course, we can hold the insurance company accountable so that they pay what's fair.
Our mission here at Free My Pain Now is really making that patient become their own healthcare advocate, creating a great team around them that they can handle these type of situations that life throws at you. And Michael, it's a pleasure to have you on our team and working with our patients. And I don't want to get into too much of all the wonderful things you've done, but Michael is very humble. He's one of the top 30 attorneys. And give me those. Come on.
No.
Under 40,
I don't like to brag. I don't like to brag. No, there's just various awards that sometimes are issued, top 40, under 40, Rising Stars in Georgia, award with Georgia Trend Magazine. Thumbtack has me rated number 1 in North Georgia right now. So
boom, I love it. The other thing that I like is, and I don't know where you got this, but you are not scared to go to trial.
Oh, it makes a big difference with the insurance companies, certainly.
I'm going to make you say this one thing you said is that, you are on this planet. You live in this community. What was that thing you said one time?
Oh, there was just a drunk driver caused an accident, and the insurance company was making terrible offers to the client before I got involved. I filed a lawsuit to increase the pressure and let them know that the penalties, especially for the drunk driving, financially were coming down the pipe. And to avoid the trial, I essentially told the insurance adjuster part of what my closing argument would be, which simply involved that I was going to be looking at a jury and telling him, look, this is a one opportunity for you as citizens of this county to send a message as to what tolerance level we have for something as terrible as drunk driving and injuring people involved. And anyway, they changed. They decided to settle for maximum policy limits very quickly after that. So
a man you want on your side. Thank you so much, Mike.
Thank you, Matt, for having me.
All right. Welcome back to Free My Pain Now with Dr. Matt DiDuro. This is the second half of our segment. And today I have 2 wonderful guests with me, Richard Scalise and Trishelle Thompson.
Yep.
Thompson, perfect. And the reason I have you both on is Richard is also not only a friend, but a patient. And Richard had a terrible issue happen October 23rd of 2018. You had a stroke.
That's correct, yeah.
And you're awfully young for a stroke, Richard.
Yeah.
What are some, did you have any of the warning signs, anything?
I had a few headaches about a month prior, but didn't think anything of it. And then we were bending down to pick up a suitcase in the Bahamas. And
you were in the Bahamas when it happened?
Yeah, not where you want to be, by the way.
Oh.
No.
Okay, yeah I bet.
Yeah, and just got real dizzy when I came up, and my left arm went numb, left leg went numb, speech gave out. It was a very surreal experience, yeah.
And I'm sure Trishelle went into hyper mode and started taking care of you, and she's been there. Panic mode, really,
more
first,
panic mode,
I guess.
Yeah.
We actually thought it was low blood sugar at first.
Okay.
I mean, he was struggling to tell me what was wrong, so we really weren't completely sure what was wrong when he just said to call the medic. I was like, are you sure? And then the second time he said it was completely slurred, and that's was like, okay. And it was 5 o'clock in the morning when this happened too.
Wow. So, and one of the reasons why we're highlighting you is because we like bringing in real people who've had issues and how you became an expert on this condition.
Yeah.
And even though you're young, you're just 36 right now.
Correct, yep.
We've seen in the last 5 months, we've seen Luke Perry, who was 52 years old, from 90210 fame, who died from a stroke. John Singleton, who is the director from Boys in the Hood. He was 51 years old. And it goes back to, there's an underlying issue that there is inflammation within our body, and sometimes we don't even know what's going on. And sometimes you could be predisposed to it genetically. You didn't have that. It wasn't a Berry aneurysm, right?
Oh, no.
And you were pretty healthy. You'd been to the doctors recently.
I actually had my yearly physical about a month prior, full blood work panel.
Everything looked good.
Yeah, I mean, stellar reviews, healthy as a horse. sent me on my way.
So you recover. Oh, no, you don't recover. You go through this terrible stroke. You're somehow you get admitted into Shepherd's Spine Center, correct?
Right. I was in. So we did Bahamas Hospital. Then I was airlifted from there to Broward County, where I spent a month, and then from there to Shepherd Center.
Okay.
So I was in a wheelchair for about a month or two. Yeah.
And then our local neighbors here, Shepherd Spine Center, did some amazing work.
They're fantastic. Yeah.
And
I'm running again. I mean, I'm driving. I'm functioning like I was before, minus some deficits in the hand. But yeah.
And Shepherd Spine Center in January actually got one of our acoustic soft wave, what we call the mini lithotripsy devices. And so I was fortunate enough to be one of the training physicians to work with their staff. But they weren't. They actually kind of referred you out, or how did that work?
Yeah, because Shepherd Center, phenomenal things, but unless it's FDA approved for a condition, they are a little more conservative with using it. So
it's FDA cleared, and so extremity wise,
exactly,
they weren't going to use it.
Correct, for the tone. That's what I wanted it for. I read enough articles online. That's how you and I hooked up, and we started using it, and it's been great. I mean,
we noticed you've had 3 or 4 sessions total, but Richard didn't have. I mean, he had some great goals. He wants to get back to fully functioning, but at the time, his left wrist was in a spastic type of contracture, and he had tightness in his left shoulder and left elbow. And show us now what's going on. I mean, we are videotaping. This is a radio show, but for people at home, just show them what you have.
Yes, I mean, I can't tell you my hand was like all locked up, but now it's I can at least move my arm and my fingers.
Show it over your
fingers.
Yeah, and it's just getting the fingers start. So when I saw you,
do that again with your hands.
Yeah.
Oh my gosh.
So when I saw you, this hand was locked up. Remember?
Right, I remember.
So
it was like this.
Yeah, so it'll take some time to get the dexterity back, but it's light years ahead of where it was when you and I first met a few months ago, right?
Right, and I give you a lot of the credit, both of you, because again, you're like you weren't a victim in this. You decided, listen, I gotta take control of this. I gotta be the person making the right decisions about my future treatment. And you went out of the box. You are still going out of the box. Tell me why you did that. Well,
I mean, the doctors kind of just treat you when you're there, but that's about it. I mean, so
they want to get you fixed up so you can go home,
sit on the way,
work on, do your activities of daily living.
You gotta think outside the box. Otherwise, I'm just another guy in a wheelchair that's waiting for something to happen. So between you and a few other out of the box ideas, we're exploring everything. We got nothing to lose, right? I mean, so we have the TRT. The shockwave's been fantastic. We got stem cell coming up next month. So.
You're going to Germany. We're really excited about that.
Yeah.
And see where you're, and that's just a great asset that they've picked you to be able to go over and work with them. And I'm excited about it. And then also in October, you're going to be doing the Neurology Institute.
The Embrol, the peripheral interocept, I think it's called. It's basically used for arthritis.
Psoriatic arthritis.
And that doctor's theory is chronic inflammation in the brain post hemorrhagic stroke, and this will help with the anti-inflammatory.
I'm really excited. I mean, you're 8 months out, and you're doing wonderful. You're moving great. You're back in the gym. You're benching with your. I mean, like you started out where you couldn't even lift the bar.
I couldn't lift a water pipe, or I was using I started with my cane.
Okay.
And now actually I'm getting the Olympic bar with 45 pounds on each side, so I'm up to my $150, $145.
That's amazing.
Which isn't like where I was before, but far cry from my 2-pound cane.
Yeah. So
he's riding a bike.
You're riding a bike.
Riding
you
bike.
got stability to hold yourself up.
Riding bikes. Yeah.
That's
not the motorcycle though. We sold that.
We're done with the motorcycle.
Yeah. My mom and Trigel were both very happy I sold the bike.
Yeah. So you decided to really dig in, find the research. I mean, even at the hospital, you were pulling up articles to the doctor. Tell us about that. What was the story there?
Yeah.
I mean, several times they would just say, this is what we're going to do for you. And, you have to go home and do a lot of therapy at home. And he would sit on his phone researching. He's like, what about, there's this on the 6th floor. Can we try that? And you're like, oh, actually, yeah, we'll set you up an appointment for the 6th floor. And it's like, if he wasn't doing that research, we would have never known about what was happening on the 6th floor. But that's happened so many times where, you know, even when he was in the hospital going through all that he said, hey, can we try this? Can we try that? Sure. But if he didn't, it was just PT, OT.
When I brought up TRT, they just kind of said, well, you know, and it's
We've
like,
got that in the functional rehab.
It's like they use it on a few spinal people, but not for stroke. I said, but there's been some research online. And again, online's full of fact and fiction, right?
Sure.
So you got to sift through the noise to kind of figure out what's fact, what's fiction. But the TRT, when I brought it to their attention, that's essentially how you and I came to be.
Right.
And I would have preferred that we used it when I asked them to, because it's been beneficial.
Right.
So now I just got to come to you for that. And, you know.
And that's one of the reasons why we do video case documentaries on all our patients, because we're getting to the point where people just won't believe the recovery. And, you know, after the second visit, I said to you guys, will you come on my podcast? Because you have such a great story, both of you. And you know, you guys together as a couple, there's not much you guys are not going to be able to face in this world if you're able to handle stuff like this, right?
Yeah.
And that's really what it's about, is getting the knowledge, making the right choices. And I'm sure you were pretty healthy. I mean, you were an entrepreneur. You have that type of brain. You've been successful in business.
Yeah.
You're not just going to settle for the average.
Yeah. I mean, I don't like it's in the doctor's eyes, I'm basically better, but I'm not where I want to be. So I got to keep pushing.
Mm-hmm.
But the average stroke patient is also 65 years old on average nationally. So I'm, you know, way outside the data.
And he does so much like at home that most people never would know about. Like we've seen 1 million people in Shepherd Center that they're probably not doing the kind of therapy that he's doing at home. Like any free moment he has, he's doing quadruped or Savoflex, like all kinds of
working on connecting
all
the
day,
brain to all your
I mean, even if
muscular
we're in a
activity.
hurry, instead of using his right hand to open the door, he will take the time and use his left hand for everything, even if it takes however much longer. He actually takes that time to do it instead of just rushing through it like, oh, I got to be somewhere, I'll use my right hand. And I'm sure a lot of people don't do that. And he's just very positive all the time. You would think that experiencing that, he would be kind of negative and, you know, down. And he's just not. He handled it really well.
Yeah, getting there.
Yeah. Well, you know, that's why we wanted to feature you and your story, because although it started out sad, you know, I honestly think at some point you're going to be in healthcare doing something. I really do. I mean,
well, thanks, Doc.
You don't get to this point through everything you've done and not be able to, you know, take that knowledge and
we're not done yet.
else.
I mean, I got about a year or two left, easy, right? So I'm not done, and we are not done.
No.
Yeah.
No. So, I mean, that's the message out there. People are in pain. They're suffering. They're looking for answers. I mean, you're not taking opioids or medication, or you're not doing a lot of drugs or anything like that.
No prescription, no nothing.
You haven't had to this whole time.
I
No.
don't even drink coffee.
It
Like
can be
he
baby
does
aspirin,
nothing.
but I don't taking. There's no medication because there's no diagnosis.
Right. So, you know, that's again outside the norm as well. And we're looking for, you know, alternatives to drugs and surgery and things that can work and help really activate your own natural healing effects in the body. So, well, I'm excited. I can't wait to have you back on in the next 3 months as well, just to show your progress and see where you're at. And you can go to freemypainnow.com on our YouTube channel. You can see Richard and Trishelle's journey, and just kudos to you, Trishelle, because people
She's
forget
been a rock
about
star, yeah.
what it's like to be a caretaker, and you know the stress that goes on you. So, you know, we always like to acknowledge that person in your care.
Quick story real quick. I actually got our parents' permission the day before we left for the Bahamas. And I was going to propose to her in the Bahamas, but my stroke kind of sidetracked things. But we are getting married next February.
Are you proposing to her right here on the air?
No.
Well, best wishes.
We're already there.
She's been through a lot. Yeah.
Yes, she has.
Yeah.
Well, thank you guys, and really looking forward to the next few months as well.
Yeah.
Recovery.
Absolutely.
Thanks.
Thank you.